Well, good morning, everyone. This is Dr. Josh Mason with Active Health Clinics. We are starting maybe a smidge earlier right on time, so I'll just give everyone a couple of minutes to get on here. But today we're going to be talking about neuropathy and how it devastates a lot of people in our community and how Active Health Clinics has a great solution. So as we wait just a couple of minutes here, I just want to welcome you all and thank you again for taking some time out. This is Coffee with the Care Team, so I have my coffee here ready to share with you guys some stuff about neuropathy. So as, again, more of you come on here, I just want to outline for you that neuropathy is a condition that affects thousands and thousands of people. And unfortunately, this continues to grow. It's probably one of the fastest growing conditions that we're seeing in the medical industry. And we're seeing that because of the cause of neuropathy. The most common cause of neuropathy is diabetes, which we all know more and more people are having problems with diabetes. But also it can be caused by even medications for, example, cholesterol. So some statin medications will actually cause neuropathy. Chemotherapy can cause neuropathy. Our lifestyle, any injuries that we can have can lead to neuropathy. So there's lots of different things that can cause neuropathy. And so many times we have patients that are just unsure. What is neuropathy? So neuropathy typically is characterized as a condition where you're feeling numbness or tingling, or even just it doesn't feel quite right. And typically this is on both sides of the extremities. Most commonly they're in the feet, but people do get it in the hands as well. And so again, I think some of the keys there is it's typically both sides at the same time to be true neuropathy. Neuropathy is a systemic condition, so meaning it is caused throughout the whole body. There's a systemic condition that has caused the neuropathy, which is the nerves are starting to lose blood supply. They're not functioning appropriately. They're sending inappropriate messages. The nerves are breaking down and they're losing their health. Where this can be very detrimental to people is as we lose that feeling, we also start to lose proprioception, or our ability to feel ourselves in space. So if it's in the lower extremity, people will start to lose their balance, or they'll start to actually, for example, driving, they won't feel their feet on the gas pedal or the brake pedal. So they'll start to lose confidence in their driving. They'll lose confidence in their balance, and consequently they'll start falling or tripping on things more frequently than they had before. So neuropathy can start to lead down the path of losing their ability to function and live on their own. And it just doesn't get better typically. Neuropathy is a progressive disease that starts and gets worse and worse and worse over time. This is a condition that unfortunately there is not a great solution for. So with this condition, when patients do go see their doctors for this condition, typically they're given medications that just kind of mask the symptoms. A lot of these patients will have a ton of pain. So one thing that doctors will sometimes give them is strong pain medications, which obviously can lead to some other symptoms or other side effects. But it doesn't treat the root cause of the problem. So we're very sympathetic for these patients because it is a debilitating disease over time. There's lots of research that shows once it starts coming, if left untreated and we're not addressing anything, the blood supply to the extremity continues to get worse. The nerve it starts to die off and we just lose complete sensation to the extremity. And unfortunately, a lot of these people not only lose their ability to function, but some of them will end up in amputation. And so we really see this as a huge condition to help patients with and really help them because there isn't a solution. So we've addressed there is pain with this at times. Not everyone has pain, but some people will have pain at night, during the day. There's a lot of variation here because we're dealing with nerves. And ultimately the nerves in the extremity from the distal extremity. So usually we'll start distal in the feet or distal in the hands, meaning away from the body. And so that can be different. So a lot of patients will come in questioning whether they have neuropathy or not. And so some patients will say, hey, I have it in my leg and it goes down into my foot. And that probably is not neuropathy, especially if it's one-sided. And we help those patients. That's a radiculopathy, meaning that the nerve problem, the nerve is being irritated and is a nerve problem, but it's probably starting more central, maybe in the low back, being pinched, and then referring down to extremity. Where neuropathy will typically start far away, like in the feet, bottoms of the feet, toes, and then kind of start to progressively work its way up closer to the body. And again, it's usually both sides. We can help patients with either of those conditions, but today we're focused on neuropathy. So when these patients do go to their medical doctor, they could have pain, so they may start with pain medication. And there's other medications that they'll try like a Neurontin and gabapentin, to name a few. And again, a lot of our patients that are coming in have been on those medications, and it's given them little to no relief. So not only is it not helping, but as far as their current symptoms, so it's not even covering up the symptom very well, but it's not making it any better. This is when you get on those medications, it's not really that it's improving your neuropathy so that someday you can go off those medications. It's just maintaining where you're at or just helping you deal with the current symptoms. So when Active Health Clinics, when we came across treatment for neuropathy, we were very excited because we've been treating patients for 15 years, and yes, they may not have been coming to us for neuropathy, but we knew they were suffering with neuropathy, and we were as frustrated as they were that they couldn't get help for neuropathy. So when we came across a protocol that actually helps, we were super excited. So there's a huge need for treatment of neuropathy, not only because it's a really fast growing condition in the medical industry, but there's really no current treatment for them until now. So Active Health Clinics, we have developed a wonderful protocol that we can treat and help patients with neuropathy. And it is something that is actually trying to reverse the effects of the damage to the nerves and the blood vessels and everything in the extremity to actually bring back that feeling, bring back that proprioception, bring back their balance, bring back their function. And so really that's what we're trying to focus on with patients, is actually healing and reversing their neuropathy. That is the goal of the treatment. How we are doing that? We are using the main star. We have lots of different tools I'm going to outline, but the main star of our neuropathy protocol is our class 4 laser. So class 4 laser is using a technology called photobiomodulation. And so if we just break that down, photo meaning light, bio meaning cells and tissues, modulation meaning modulating them and making a change in them. And so through this class 4 laser, and this is an extensive laser treatment, we begin and treat the entire nerve from the center. So if we're treating a patient with a lower extremity or in the feet neuropathy, we'll start treating the nerve right from the spine and work our way down both legs and treat the entire nerve all the way to the tips of the toes. So it's an extensive 40-minute laser treatment each time we do the laser treatment. But what that's doing is it's stimulating angiogenesis, so meaning new blood flow and new blood growth, not only to the surrounding tissues, but also to the nerves. And we're helping stimulate those nerves and actually heal and reverse some of their damage that's currently gone on. And so we can actually see a reversal of the neuropathy. And so this is something that's, up until now hasn't been able to be done with patients. So this class 4 laser is stimulating with different waveforms of light to different cells to actually heal and regrow these tissues and help reverse the numbness, the tingling, the pain, the feeling that I got a sock rolled up in the bottom of my shoe. So all these different things. Patients just say, my feet just don't feel right. So it's amazing that we're able to help patients with this. And that's the main star of the protocol. When patients also are going through our protocol, in addition to the laser, we'll also do what we call compressive therapy. So we have these leg sleeves. Again, I'm going to stay focused on the lower extremity because it's the most common, but we do the same thing if a patient has an upper extremity. So we have these leg sleeves that we'll put on the patient. They look like ski boots, essentially, and they all go all the way up to the leg, ski pants, if you will, and they're hooked up to a pneumatic box. And essentially it looks and kind of feels like a big blood pressure cuff. So with specific rhythms and time, it fills with air and compresses the tissue and then releases. Fills and compresses and then releases. So allows blood and encourages blood to come in and out of the tissue, which encourages blood flow as we're doing the angiogenesis, the new blood growth. And so it is a very good complement to the laser. In addition to that, we are a chiropractor, so we do believe that we need to adjust the spine at its source. Just like we're starting the laser treatment in that low back, we're also treating and making sure there's no nerve pressure coming from the low back as we're treating the entire nerve tract. So chiropractic is part of the care plan. In addition, we work with our rehab team and we do specific rehab movements and protocols to help encourage and stimulate that nerve growth. For balance, we're utilizing specific exercises both on and off a vibration plate. So we have a very high-tech vibration plate that patients will do some of their exercises on. And the vibration, again, is stimulating proprioception, stimulating nerve growth, stimulating blood flow. And so we're doing all of that at the same time in addition to the exercises. So that helps us contribute to the laser and the compression treatment. Now, we know this is a systemic condition. So another component that we provide is we provide a specific nutrition pack of vitamins that help the entire body. It decreases systemic inflammation and is isolated on trying to help have the specific nutrients that we need to heal those tissues in the extremity to reverse these symptoms of neuropathy. And so it is a great protocol. And the nutrition really just helps stimulate the cell growth along with the laser, along with the compression to get the blood flow in and out. And then also we're stimulating it with a vibration plate. In some cases, not all cases, we have some cellular injections that we'll do in the low back and in the legs. If it's a severe case, we will use those in addition to those other therapies to help, again, the entire process. The goal is to actually heal tissue and to turn those nerves back on and let them heal and actually reverse the damage that's taken place to the nerve in those tissues. We want to actually reverse things, not just cover them up with a medication. We're actually trying to turn back the hands of time if we can, and actually give you that function of the nerve back so that we can have the balance that we need, not have the pain, not have the irritating tingling. We want you to be able to walk and feel comfortable walking. We want you to be able to drive and feel the gas pedal and the brake pedal. We want you to be able to function your life exactly how you want. So we're using all of these tools to actually reverse this process. It has been amazing. I'll be honest with you. This is one of the best things we've ever added to active health clinics. The number of people that we have seen dramatically improve with their neuropathy symptoms is immensely rewarding to be able to see, considering all of these people have been on medications for long periods of time and have not seen any improvement, not getting any relief. So a lot of the patients that come in for this treatment have kind of lost hope. So when they come in and we're able to actually help them, it's amazing. And for all intents and purposes, it's a very short treatment. So everything I just outlined, we typically do for patients in a 6-week period of time. And so we're seeing a 90% difference in 6 weeks. It's amazing. On average, about 80 to 90% difference. It is an amazing program, an amazing protocol, amazing treatment options that we have for our patients that have been suffering for so long with these neuropathy symptoms. And so it's just a joy to be able to offer this to our patients that are coming in. So at this point, I think I've outlined that neuropathy is a huge problem in our healthcare industry. It's a huge problem not only because it's debilitating and it affects people's lives traumatically, but unfortunately, the typical medical paradigm does not have a good solution. The typical medical paradigm is covering up symptoms and at worst giving them more side effects because of the medications they're using. At best, patients are, again, covering up the symptoms. At worst, they're getting no relief and no reversal, and it just continues to progress. So that's the best case scenario under the current model. So again, we are so excited to be able to offer our class 4 laser, our compression sleeves, our rehab with the vibration plate, our specific chiropractic care, and our nutrition system to go along in a 6-week plan to actually help and reverse the neuropathy symptoms for these people. And it's long lasting. It is absolutely amazing that people are getting relief, getting their function back, getting their lives back and getting back. And they never thought they were going to be able to do this. So it is my hope that if you're listening to this and you have neuropathy yourself, maybe you'll consider trying. When you come into our office, we actually do an exam. We have you fill out a questionnaire so we can quantify how much it's affecting your life. We do a neurological exam, including vibration, pinprick, light touch, reflexes, muscle testing. Again, so we can quantify how you're doing. When you choose to continue and actually go through the treatment, at the halfway point of the treatment, we do expect to see this as a progressive improvement. So at the halfway point, we will redo both of those. And so we can see progress. So you can see progress. Most of our patients are feeling the progress, but we like to quantify that progress about halfway through. Once things are going exactly how we want, then we continue with the protocol. We get to the end of the protocol and we'll do a post test. Same thing, same questionnaire, same neurological test. So again, that we can quantify the results and see the improvement that you have seen. And you obviously would feel the results as well. So that's kind of the process. So if you're interested, if you have neuropathy and you are tired of dealing with the medication that you're currently taking, if you're tired with having the pain, the numbness, tingling, that annoying feeling in your feet, if you're tired of starting to lose your balance or you're fearful of the future, if this continues to progress, I encourage you to just contact us, reach out to us, get in here for an exam, and let us check you out. Let's see if we can help. This is, again, what I've alluded to earlier. This is a very rewarding protocol that we've been able to help a lot of people with. We've been doing this for almost 2 years. We're just shy of 2 years, and we've helped, at this point, hundreds of people with neuropathy, and it's just been an amazing process to see. So we hope that we can help you. And if maybe you're turning in and maybe you don't have neuropathy, but you know someone that does have neuropathy, you should have confidence in sending them and making this recommendation that they come in and check out Active Health Clinics for the neuropathy treatment. We feel really good and really confident about this protocol and how much it's helping people. So I hope that you would consider for yourself, or you would consider referring this message to someone else, because it is amazing how awesome it is to be able to help tons of people. So I hope you find this helpful. If you end up posting some questions on here, we will try to get back to you and answer those questions for you. But otherwise, we really look forward to helping as many people as we can. So if you're one of them, look forward to seeing you soon.